Folks, welcome back to another episode of the GPH podcast. When you come to NYU GPH, you get access to a vast network of pioneers and innovators all around the public health space. And today's episode is something that exemplifies that. Today, I'm joined with Rimsha and Wilson, Rimsha Minhaz, Wilson Wang. They're collaborating on a major caregiving and health tech project that began through NYU or outside of NYU, and then Rimsha got connected to Wilson with her multidisciplinary background from dentistry, and now she's pursuing a master's in public health here at NYU GPH. She met Wilson here at GPH that sparked an awesome partnership and blended into research, innovation, real-world impact. And right next to Rimsha is Wilson Wang. He's a seasoned health professional and founder of WD Home and CEO of World Doctors, there are two companies, which is World Doctors, and then WD Home is a part of World Doctors, which Rimsha is working on right now. Wilson brings decades of experience in clinical care, policy, and health tech together. And together, the two of them are tackling critical gaps in caregiving through technology, WD Home. We'll explore how NYU brought them together in a groundbreaking research that they're doing right now and where it's taking them in the future. Rimsha and Wilson, welcome to the GPH podcast. We're glad to have you here.
Thank you.
Thank you. That was a great introduction.
It's all of you have created this introduction. I'm curious to start off with you, Rimsha. What got you to GPH? Tell us about your path. How did you even come here? There's been a long journey, and we're curious to know what got you here.
Yeah, so I was always interested in public health right from dental school because when I was pursuing dentistry, we had a subject called public health dentistry through which we could go to rural areas around South India and we could treat people in schools or in community setup. So I came from Kuwait and it was like a huge culture shock for me because I had seen India through movies and books and I had a different vision. And as me and my friends as providers, I just was not comfortable seeing that huge gap because people who would come to the hospital were totally different and from a different economic strata. And you go there and then they do not have basic access to health or just to a dentist or just clean water. So I thought that I need to do something because I did not just want to have just a patient-doctor relationship my whole life. So I was interested in public health. I started looking for courses and that's how I stumbled upon Masters in Public Health. So I was looking into universities, so I shortlisted some of them and New York University happened to be one of them.
You're one of the first few dentists I'm speaking to on the podcast. That's such a unique way that I have. There's a skill set I have, but the access to that skill set is completely missing, and that's how you found your public health path.
Yeah.
Is your dentistry background coming in now, or you keep relating back to it here at NYU?
Not coming in because here we study about my concentration is global health. Mm-hmm. So we study about how do you build an intervention or what are the gaps, bottlenecks, or how would you, what are the barriers to something like socioeconomic barriers, and then you go deeper into that. So it's more to do with your perception on things. So yeah, I just feel like my dental, medical, whatever that part of the career was, it does not relate to what it is right now, but I can get to know the gaps and I can get to know how things happen. Yeah.
I find it fascinating how years of education goes into practicing dentistry, but then eventually it takes you into public health and shows you larger problems in the world, and your kind of heart went into that direction. Now you're learning about interventions and bigger issues that influence these pockets of public health in the world.
Yeah, it's not that I'm not interested in dentistry. I would love to practice dentistry, but I feel that right now I wanted to explore this part of medicine or providing care. So that's why I shifted to public health, and I want to practice dentistry. I want to keep that alive, and I have to find a way in between.
Yeah, you are the personification of a GPH student, there's something that's wrong. I need to figure it out, and that's what got you here.
Yes, thank you.
Wilson, how did you, you have done so much in your world. First, I'd love for you to give a brief intro on who you are, where you got started perhaps, and then how did you stumble upon GPH through that?
I'm 54 now, so it's hard to know how far back to go, but I think a lot of people wonder, well, why does a pediatrician fall into public health? Because what Rimsha was kind of referring to, that clinical care is so much different than public health. Clinical care is about a one-on-one interaction where you try to be of assistance. But in public health, we try to scale that. We try to help or aid as many people as possible who will never meet through population level interventions. So
Can you explain that, what that means, population level interventions?
Yeah, it's more like as a doctor, I might think I help someone because I give them advice to wear a bicycle helmet. And a public health intervention at its most basic level makes the helmet wearing a law. And so you're able to affect a lot more people. It gets people a little bit riled. They want to like ride their bicycles and motorcycles without helmets. But fundamentally, public health is also about like balancing population interventions that can really help a lot of people with people's individual rights. And that's why sometimes, in the United States, we might not admire or respect public health interventions as much as maybe other societies.
So what else did you do beyond? So you're a pediatrician, you work in the ER. There's a lot of work you've been doing for years at this point. I would say you're a specialist in your field. How did that CEO hat, the founder hat come in? And then how did you come into GPH in that experience?
Yeah, thank you. Well, when I was in medical school, like most clinicians like Rimsha, of course it was very fulfilling. But then you notice certain patterns, like the same people would always come into the emergency room, or that you were doing something which in your inside make you think, okay, I may be helping, but this person has so many other issues that transcend a clinical problem. So between my third and fourth year, I just decided to act on it. I said, it's not enough. So I was able to go to UC Berkeley, which has a public health school. And before I started, I didn't know anything. I thought public health, immunizations or something like that. But what I learned at Berkeley was that public health was social justice. Public health was equal access of populations to resources that would keep them healthy. What I kind of knew as a privileged Asian American, like it's about having a home over your head, a neighborhood that's safe, some good foods, opportunities for education. So that stuck with me. I did that for a year. And then I went back to medical school, finished my residency, and I practiced for a year and a half. And I had that same feeling as a clinician. I had all these patients that would say, "Thank you so much, Dr. Wang, for helping me." But inside, I knew I actually wasn't helping them. I knew their parents were helping them, but I wasn't really helping them. So then I went on to a career in politics and international health, et cetera, and eventually landed into the School of Public Health here at NYU because as I advance in my years, of course, a big part of being a public health professional is to bring others along the way. And that's why I met Rimsha. Like I, at every opportunity, try to, to tell the story that I've experienced so as to bring other people along, because I know it's not just me. I learned a long time ago that real leadership is like you die and it's fine. The intervention goes on. People are sad for a moment, but the intervention continues.
It feels like there is a similarity in some way. There's like, what? I need to figure this out. And then is it Dr. Wang is okay? Or
yeah. Wang. Uh-huh.
Dr. Wang has a similar journey where like something is off about this. I need to figure it out. And same for you. Something is off about this. I need to figure it out. So I'm curious. You mentioned how you met Rimsha, but how did this meeting happen? I'd love to hear from your side, Rimsha. How did you connect with Dr. Wang?
Okay, so I have a story for this because when I was applying for schools for public health, there were many schools in the picture, and NYU was conducting few webinars with staff. So I was a part of those webinars. I participated in those. It was through Zoom, I guess. So yeah. So Dr. Wang was talking about his Liberia and Rwanda mission through IRC, and he spoke about how he battled with the Ebola pandemic at that time, the Ebola outbreak that happened, and he built this protocol and all of that. And then there was this moment where they were just standing there, and then they had to be sprayed with something, and then they were tested if they had Ebola or not, and so you were dead or not dead. So for me at that time, I was doing my outreach programs. It was, the amount of dedication that was shocking to me, and I was like, I was the first time I met Dr. Wang, he was my professor in my first semester in a course called Data-Driven Decision Making. So I was like very excited because I was going to be taught by this amazing professor. So I came in and I was actually very nervous. I never went up to him and I spoke to him. There was something during the course that I wanted clarifications with. So I sent him an email asking for some details. So he asked me to come meet him. So that's when I went and I spoke to Dr. Wang, and then we had a conversation, and that's how things started.
What is before I get into this awesome connection and where it took you later on, what is outreach program?
Outreach program is when you know that a certain community or a certain area in a village or a town, they do not have access to a dentist, or they do not have access to screening for pregnant women, something like that. So you build a team and you go to that place and you set up a clinic sort of in a school or in a small area where a religious setup, like a temple or something. You set up a whole system where you get your instruments, you get all the screening things. You go there with your you go there in your dental vans, and you just provide them with basic care like scaling, cleaning teeth, or fillings or extractions for people who can't afford for free. So we as we finished our dental school, we had to do a 1-year internship. That's when we were like fully trained, so we could go and do the basic dental procedures.
And then you got to hear about his experience on the webinar as well.
Yeah.
So I'd love to know, where did that take you? That one email. So obviously it was like, Professor, I have a question.
Yeah.
It starts over there. And then where did that take you? How did you end up where you are right now working with Dr. Wang?
The email was about a story, the story of Danielle. It was about a kid in Rwanda or Liberia?
Actually, Liberia.
Yeah, Liberia.
Nice.
So I was really inspired by Dr. Wang's response to that story, and then ultimately that kid died. So it really moved me. So I wanted to know more about that entire story. So I wanted to go and talk to him about it. So we spoke, and then it was just a good conversation. And after that, I heard from Dr. Wang's that he was starting this older person care management through WD Home. So just 2 weeks before, my grandmom had passed away. And I just felt that, okay, something seems to be in place. I don't know. I was grieving that time, and I saw this email, and I went and met him, and then he told me that he's starting this thing for old people, and I just wanted to be a part of it. And we went to North Carolina after that. It was an implementation product. He had built this app that was about care management for caregivers. So yeah, it just happened that way.
Could you explain what an implementation product is for those that don't know?
An implementation product is something. So we have a plan on how things could be better at one place. So we build something so that their life is easier. So your daily activities are easy. So the product that we built was an app. This in some other settings could be something else too. But since we deal, WD Home is a app and health tech company. So this was an app, and it was for the caregivers. And we went there, and then it was a basic thing how doctors and nurses have the opportunity, and they have the skill set to chart their daily chores or their diagnosis. Caregivers don't have that. So there was this huge gap. So they don't record what they see every day. So that's a huge gap, right? So we need to know what's happening. They are taking care of old people who are probably in their 80s and 90s, and then you don't know what's happening with them. You don't know what food is fed. You don't know how easy it is for them to access or have access to a washroom or toilet, or have food. So this app was just built for caregivers to chart their daily routine with each individual in a resident or an assisted living. So yeah, so we went there, and then we asked the caregivers to use the app, and then we saw if it was helpful or not for them. So we were testing that thing. So that's how we implemented this system
into a final product over time.
Yeah.
So Dr. Wang, Rimsha sounds brilliant with everything, the whole story that's taken her over here. I'm curious to know for you, what was it from your perspective, a student that was in my class and then connecting and like collaborating on a project? How did that come to life for you with Rimsha?
Yeah, I mean, Rimsha has like a nice balance that many students have of kind of a respectful aggression.
Nice.
Like that in American culture works. And at NYU, there are a lot of students that come from abroad, and they have to understand that when I've gotten the job of my dreams, it's because I knocked on the door without an appointment of the person I wanted to work for, right? There are certain levels of that, but Rimsha did it in her way, that she had a question that was natural for in a class that I was teaching, and then we had a conversation. From that conversation, I could tell that Rimsha was bright, and I'm selfish. I want people to help me at any turn for free. When we go on projects, of course, I pay her per diem. But yeah, she's learning. She's volunteering. She's working all those together, and so I had a project. First, actually, it was an unsuccessful project where I tried to connect her to a job with the IRC, International Rescue Committee, that gave me my first start in public health. But it didn't work out. But then through that interaction again, I realized that, hey, this person can learn a lot, but also can help me a lot. So I had this project that was about to happen that was over a year in the making. I would say a year plus 20, right? A year to do the thing, and then maybe 20 years to have the background and experience to actually deliver it. And so that was the implementation in North Carolina.
And then you're a project manager now at WD Home. How did that happen for Rimsha? Like, when did Rimsha transition into this project manager role? You're still in school at the time we're recording this video in 2025. You're going to graduate this semester. So how did that whole thing start for Rimsha?
Yeah, I mean, when you're in a startup, you're the project manager, you're the COO, you can be the co-founder. A lot of it's titles, but basically Rimsha is kind of my left-hand woman. She'll help me with the things I need to be helped with. You know, I also very cognizant of the types of skills or opportunities that might be meaningful to someone who's young in their career. And so I want her to be a project manager because I think it's actually one of the number one skills that can be taught at a school of public health. Like, how do you deliver on a promise, and how do you measure that promise was fulfilled? So, but then she does a lot of other things. She as part of a project manager, she's not only managing it, but she's actually the recipient and actually doing the thing in the field. So sometimes she could, be the implementer. Sometimes I need her to do a pitch. So maybe now all of a sudden she becomes sales. So she does everything, but I like the title of project manager because it really means that someone has oversight over all the things that you're trying to do.
Yeah, sometimes you need her to talk on a podcast as well.
Yeah, and she has no ability to say no.
See, that really encapsulates what you're doing in the word project manager, because that word is so vague, right? A lot of students as well have been offered that role at different companies, but this is what, in the world of public health, it really means you got to be doing a lot of things unless it's a very specific company with a specific title. So that's I'm so glad that this connection happened, and the way it happened as well, a webinar, a class, and then boom, something flourishes out of that. I want to go a little bit into the company and the work it does. So the first question I had for the people that are finding out about WD Home for the first time, what is this? Why is there an opportunity in the market? What is the reason for this company even coming to life? You both can like popcorn style this as well. What is the need for this out there? Why did you create it? Why are you putting so much effort and a lot of work into this?
Yeah, I'll start with just the foundation story, and then Rimsha can add to that story. I was teaching as just part of a curriculum handed to me. A lot of the students think that like everything we teach is like from our heart or from our brain, and sometimes it's kind of not from either. Hopefully they pass through, but I'm handed curriculum that needs to be taught. And one was about epidemiologic transitions. And that just means that nowadays people are getting older, they're living longer. And in this country, that is becoming an issue, as it is for a lot of developed or financially well-off, relatively financially well-off countries, is that there are so many old people, but less and less young people to support them. So that's just one part of, was posted in my brain. But then I found out my cousin owned assisted living, and I don't know why, but I guess it's kind of my personality. I just thought, hey, I want to visit. And I was just so struck by, first of all, these very venerable older individuals. As an Asian, I want to respect my elderly more than the other cohorts, and they were kind of just sort of stuck in like a dorm for old people. And meanwhile, since they kind of had a lot of needs, there are these caregivers who made minimum wage, and they're caring for them as if they were their children. And I thought, But the other piece of it is that the relationship was not optimized. You have like the most neglected cohorts taking care of each other or receiving care. So I thought, okay, one, in the medical profession, if you don't write something down, you didn't do it, right? So I noticed that the caregivers didn't write anything down. And that meant to me that society would never acknowledge what they did. And that could be of health impact. Let's say someone needs to take their medicines, or someone needs to be bathed, and that doesn't happen. Or because you didn't write down, I guess it didn't happen, that would have health impact. On the flip side, you have caregivers who are stuck in a job that I would volunteer for 2 weeks, and I just every day would look at my watch and say, when can I leave this place? It was so hard. Like, it pales into comparison to anything I do as a doctor, what those caregivers did every day. So I thought, well, how would you elevate that profession? How would you increase their wages? Well, I'd want to show that their work decreases hospitalizations, increases the health, and take money that would normally go to the hospital and give it to the caregivers. Well, how would that happen? I couldn't think of any job that paid well where that didn't document. So this idea of documenting what caregivers do, I wanted to both elevate older person health, but at the same time elevate the profession of caregiving. And so that's where WD Home was born. And so I worked really hard to develop that essentially electronic health record that would record, measure, and share work and observations for actionable results. So that's where it came from. Now we're on like V4 of various products, version 4. It doesn't always work out. North Carolina, great. It was a great start. We had to go there, but it didn't work. And so then we had to pivot from there. And then I'll let Rimsha tell her part of the story.
I had 3 questions before Rimsha says the story. I had like 3 or 4 questions for you about that. You encapsulate all of that in all the questions. Awesome. Like it's very clear. It's evident how your years of experience is coming to play. Like this is a necessary way to go about it. And then there's this need, but then there's a big problem in the middle and there's no solution. One person's benefiting. How do we give the people the fair chance to operate? Awesome.
Yeah.
Awesome.
Yeah. Thank you so much. Yeah. I mean, I want to say that one thing that I try to, and Rimsha kind of has it innately, is like what makes a happy, sort of productive person is someone who can respond to what they see and feel in a genuine way, accept feedback, and then go after it in a different way. And then keep on cycling and then do it with people. And if you can keep on doing that with your career, you start as a student and then you advance in your career, then it kind of can lead to progress, can lead to self-contentedness, can lead to a lot of positive things.
Beautiful. Rimsha.
I would just like to add that many people would think that when I came in, I particularly wanted to work in maternal and child health because I had worked with those populations and I saw there are so many things that could be done, and I wanted to work with a certain age group, and this happened to me just by pure. I just wanted to experience this and just wanted to go there and then see how it is, and the age group that we worked with is the baby boomer age group, right? So people are from 1920, born in between 1924 to 1964. So when I went and interacted with these old people, the only thing that I noticed is they just want someone to talk to them. They just want someone to be there when they're having their lunch. So and they were lonely. They didn't have anybody around them, and they just wanted to talk to their kids. So I thought that there were so many things. There was mental health. There was just their physical health deteriorating. How would you try to make their lives better? How would you try to give them a respectful life? They just want to live happily. They just want to be around their kids. And with today's lifestyle, the kids can't be around them because they're just busy with their lives. So I just thought that it was such a I had seen my grandmom pass away, so it was just all very raw at that time. When we went there and we interacted with the caregivers and with the old people, and we saw what this app could do and how it could just improve their basic livelihood, I just wanted to immediately be a part of this forever. So I told Dr. Wang that whatever we are doing progresses, it feels like a personal triumph than anything else. Yeah.
At the current point where we are, we're in 2025 February right now. What is the feedback you've gotten on V4 so far? What's happening out there? How are you seeing the caregivers change and react to this software or this technology?
I think for now, the successful project that's running, that's in Los Angeles, and it's the medication part of the app that's working. So the time to chart that was required before was almost 3 to 4 hours after your day ends. So the caregivers would sit down and then chart what medications were taken by each resident every day. So that would take a lot of time. So now with our app, it just takes them 5 to 10 seconds to just chart for each person, and instantly. So the caregivers don't miss out on anything. So there is no information that is like lost. And then through that, we can understand what drugs or what medications are being are being taken a lot or are not being taken, and what's causing them to feel that way, or why is their mood fluctuating, and what are the contraindications that are being seen.
Yeah, I'm so glad you mentioned that, because I was like, I didn't teach you well or model well if you didn't mention that second part. We don't really care about the medication management system. I mean, I think it's cool that it works and it makes us money, but that's not public health. That's like being part of the machine. What we cared about is that when we set up the medication management system, that we could see that 40% of the content of the medicines were wrong. So an older person taking daily ibuprofen, that over time will cause an upper GI bleed, or someone with dementia taking an anti-dementia drug that's extremely expensive, or an older person on 2 antidepressants, or daily Ambien. To look at these lists was like, it made you mad. So then we develop a systematic approach, since we have access to all these medications, to use like algorithms, statistics that we learn at this school, to then say, okay, against established protocols for management of XY conditions, what is the actual protocol and what is being violated and what should be there instead? And we can then produce reports for the families, for the assisted living, for insurance companies, and say like, okay, there's not a correct treatment of the diagnoses, but based on this other app. So again, this idea of feedback. Okay, we start with one thing where the medication management system worked, but then we want to then take the next step to say, what is the really thing we cared about in this whole thing? We care about old people. We care about old people because we're going to become old, and because they are our parents, they're our grandparents. And so I'm very glad that you mentioned that piece. It's what I care about.
This is awesome. Where do you see this going? So in the perfect vision for this company, and obviously perfection keeps changing, right? As you're discovering more information in this process, from what I'm discovering, talking to the two of you, where do both of you see this going? What is the ultimate goal for this, or what would be like a wow factor that, yes, this is what we wanted. What do you think it is for both of you?
For me, I think it would be most people knowing about this app and this technology, and like how we have social media, like how we have Instagram or things like that. Most people who have grandparents, who have parents at home, they have this app and they use it on a regular basis. So I think that would be success for me for this app and the company.
It's hard to know where, like, one thing that's kind of fun is that just yesterday, we released our first app directly to the consumer, right? Before we were B2B, like business to business. We're going after pharmacies that provide medicines to assisted living or large assisted living. But 25 million older people in this country have like severe or significant support needs. They need help going to the bathroom, eating, taking a shower. My mom, she's really with it, but her knees are really bad and she needs someone to help her out of bed, or if she falls, most of that care is not happening in assisted living because assisted living is too expensive. Even the cheapest one is $5,000 a month. That's $60,000 a year. The average American only has $10,000 in savings, so the math doesn't work out. So most families are taking care of their parents at home, which in a way is good, but they don't have a way to manage. And so we have a new app that contains the medication administration review system, management system, but incorporates other elements. First, the ability to expand caregivers to all the people in your family, your brother, your sister, some paid caregiver, but also then it lists out, because there's a diversity of older people, what their needs are, like that allows you to prioritize. So maybe my mom doesn't need help with toileting, but she needs help with her medications. So then there'll be a visual signal that says, okay, time to give the medications. And the person that happens to be with her will click that panel and see, okay, she needs to get these 2 medicines, one for blood pressure, one for movement, and give it. And when it's given, the people who are part of this network can see on the activity feed that mom got those medicines. Oh, mom was happy. Oh, they'll see a picture of her eating lunch with her grandchild. Oh, there's an event. She fell, but she's okay. On the activity feed, it will show that there's a universal note writer, and it just says, hey, Rimsha, will you check if X happened? And so everyone wants to kind of see that. So we're very excited about this product, but we don't know what's going to hold. Every founder thinks they came up with the best possible thing, and statistically they did not, or that thing was not taken up. So we'll see. But I do like this one. The other stuff we love, but we're like, nah, it probably won't work. This one kind of like we love and like, I think it might work.
I think it might work too. So I want to close with this question, because the two of you, this connection would not have happened if you two perhaps didn't connect with each other. And it's you can see how people are on the same wavelength and mindset when Rimsha speaks or you speak. There's this, I'm seeing nodding. Probably one camera's on one of you at a time, but I'm seeing a lot of nodding happening from both of you. So I'm curious to know, another student that comes into GPH. So you, from the person that you're one of those individuals that has an opportunity for someone, and you're someone that's looking for a specific opportunity. How can a student come in, or what do you expect from students? Like you said, what you saw in Rimsha, to find that connection over here at a place like this. How do people figure that out for themselves?
I think I could start. For me, I feel keep your options open. And like how I wanted to work in maternal and child health, just explore, because that way you will not know what's there until and unless you explore. So I just feel go speak to different kinds of people, see what you want to do in different fields. Don't just be in this box that you want to do just that and you will just do that. Explore technology, or explore community health, explore epidemiology, biostat, everything. Like attend as many seminars, attend as many meetings, meet new people. I feel just be a part of many things, and that way you will figure out what's really meant for you and what you really want to do. Because with this experience and with WD Home, I never knew that I would learn aspects of business. So we meet venture capitalists, we meet funders, we meet people from different fields, finance, and when we talk to them, I learn so much now. So I just feel like last semester and this semester, I've had some knowledge about business and how do we start a startup or how do we talk to people, communications, and then I did a couple of pitches. So how do you time yourself and how do you be present at that moment and how do you talk to people? Just basic life skills you learned through exploring different aspects.
Love it. What about you, Dr. Wang?
I mean, the older generation has to be held accountable in a good way. As an adjunct professor, my job is to pave the way for the next generation. So I don't know everyone, and I need someone to say, I want to meet with you. I'm interested in what you do. And of course, what older person doesn't want to talk about what they do? And then the next step will be the younger person will say, well, if there's any activity or any type of opportunity, I'd love to participate. And that's when that student has to have done their job. Because, of course, I'm not going to call Rimsha if I think she's going to be a drag, right? I'm not a charity. I need to get stuff done. So if the student is prepped and they have sufficient skills, social skills, management skills, the potential for skills, then I'd be dumb not to bring them on. And that really has been the pattern. Not only Rimsha, I've probably worked with over 15 students. I've been to Senegal twice with a group of students, and those are all students that always come up to me. I would say in 50% of the time, it didn't work out after, because maybe of me or maybe because of just the chemistry. But 50% of the time, it does work out after too. And then not only is there a continuation of the project during the NYU student's career, but probably even after. So I can't tell you, I taught, it's kind of a strange thing, but someone said, never make an enemy, because you never know if someday they'll be your boss. So I actually see that now that I'm getting older, that a lot of the students that here and other institutions I've been a part of, they become very successful, and you end up collaborating even easier the next time around because you already know each other. You've known each other for essentially the beginning and the middle of the career, and you'll end with that.
And we're going to end with that. I wish nothing but success for WD Home. Such an awesome, awesome project. And I love how this connection has happened and you all are flourishing and going into a new path. I can feel the excitement in this room, and I'm sure the people watching as well can feel the excitement when they see it on all our platforms. Dr. Wang, Rimsha, thank you so much for being on this episode.
Thanks for the
so
opportunity.
much.
So
Yes.
fun.
Folks, we'll put all the stuff in the description of WD Home and have all the information of the guests down there. And we'll see you in the next episode. Thanks for tuning in. Take care.